Hello again. Almost 1 million South Africans have died as a result of TB since 2010. It remains the deadliest disease in the country, and yet TB is preventable and curable. Today is World TB Day, and this year's theme is Invest to End TB, Save Lives. With a focus on COVID-19 in the past 2 years, the fight against TB has taken a knock. The World Health Organization says in 2020, an estimated 10 million people fell ill with TB worldwide. 1.5 million people died in that year, including 214,000 people who also had HIV. Well, joining me to discuss TB and the ways we can overcome it for good, the Director of Drug-Resistant Tuberculosis in the Department of Health, Dr. Norbert Ndjeka, the Director of the Rural Health Advocacy Project at Wits University Russell Rensburg, the General Secretary of the Treatment Action Campaign, Anele Yawa, and multi-drug-resistant TB survivor and activist, Dr. Zolelwa Sifumba. Good afternoon, and thank you very much, ladies and gentlemen. Can I begin with you, Dr. Sifumba, as a survivor? When you hear about the challenges we're facing today, when there was progress made before, ahead of COVID-19, in the fight against TB and where we are today, what goes through your mind? It's like we've taken many steps back.
So, hi, thank you so much for having me on the show today. First of all, can you all hear me? Sorry.
Yes.
Hello, sorry about that. Can you hear me?
Yes, we can hear you, we can see you. Please proceed.
Fantastic. So I am really, I guess, sad. I think for many, many years as TB advocates and activists, we were doing activism, hoping and praying that, the same things that we are doing now, the same things that we are doing now for COVID, the contact tracing, the testing, the mass screening of people. We in the TB community, I think we had been calling out for it for many, many years, being told that it couldn't be done. And to see it being done for COVID was kind of sad, but also, I guess, hopeful, because it means that, in fact, these methods to find people can actually be done. So it was a bittersweet feeling, but otherwise, yeah, I think it's been interesting to see the global response to COVID, and I think hopeful to see that maybe in time, the world can respond for the TB response as well in a similar fashion.
Okay, Dr. Ndjeka and Anele, please switch on your videos. We need to see you. Let me come to the studio. Russell, thank you very much for being here. Your organization, today you're launching a report called the State of TB Report.
Yes.
Now, we are where we are 2 years. Before we delve into all the other nitty-gritties around TB, at a high level, will this report be showing progress, or it's going to show that we've gone backwards?
I think the report takes a forward-looking approach. I think what we are trying to say in the report is that, yes, it's regrettable that we haven't had the same kind of focus on TB over the years as we've had on COVID, which was a global pandemic. But we think there are important lessons over the last 2 years. I think what COVID showed us that if with the right kind of political will and leadership, we can use the significant resources that we have in our country, both for scientific research, data systems, financing, and if we come together and coalesce around a single goal, we can achieve a lot. And I think in the report we're saying, let's build on these foundations. Let's work and coalesce around the TB recovery plan and use that capacity that we built over COVID.
I would like us to talk a little bit more about what that recovery plan could really be looking like. Let's bring in from the Department of Health now, Dr. Ndjeka. He's the Director of Drug-Resistant Tuberculosis at the National Department of Health. Dr. Ndjeka, good afternoon, and thank you very much, Dr. Ndjeka, for joining us. The theme for this year is Invest to End TB to Save Lives. We know there are many difficulties and challenges and problems that our healthcare sector in South Africa faces today. But the coronavirus pandemic, the way resources were marshaled, the way the effort was put into that to drive the campaigning and protecting people's lives, saving lives and livelihoods in the pandemic, has shown to many of us that we can do the same against a killer disease like TB. I mean, I've seen a headline describing it as a forgotten killer. Is the government prepared to invest more in the fight against TB?
Yeah, thank you. I'd like to greet the viewers around the world. COVID has exposed us. The failures that we see now have been there prior to COVID. So much as there's been negative, there are also lessons moving forward. I agree with you that the manner in which we responded to COVID shows that we have capacity, we can do better than we've been doing before. There's been a slow response, but also I want the people out there to know that when we went into COVID pandemic, there was no legal provision to do it. We had to go through an emergency mechanism. Now, there are some pieces of legislation that are in the public domain, and I think our recovery plan is really offering what we need, because key areas, one of our top 4 priorities, finding the missing people with TB, is not new. We've known that we're missing a lot of people. We miss 150,000 people with TB every year in South Africa. Now, we understand the issue much better and want to double effort and recommit to find them. Number 2, link them to care. Number 3, retain them in care. And number 4, we want to double efforts in terms of TB preventive therapy. Now, our communication strategy will have to improve, advocacy, communication, social mobilization, but the data systems also, we have plans to make them like COVID. We want to make real-time data so that people know what's going on with TB. So accountability is critical. We keep one another accountable moving forward. Thank you.
We'll unpack, Dr. Ndjeka. Yeah, we've raised a number of issues. Thank you. We'll unpack some of them as we go along. Let me bring in Anele. Yeah, I hope your connection there in Limpopo will be good for us. In your view, what should be done, Anele, to strengthen the fight against TB? Anele, did you mute yourself? Is your microphone muted? We can't hear you. We can see that you're talking, but we can't hear you.
Can you hear me now?
Yes. Yes, we can hear you.
Thank you. We are saying what is needed is a political commitment and a political will from our government and all role players. 2, we need to do to tuberculosis what we did to COVID-19 as the country. For your information, Braden, in South Africa, every day between 165 to 167 people are dying of tuberculosis every day. And we cannot just sit down and fold arms as if nothing is happening. So we need to roll up our sleeves. We need to commit on everything that we are promising the people of South Africa, not only on paper, but on the ground, to ensure that we improve the quality of TB services.
Okay. Dr. Sifumba, please note we are live on air. When you switch off your video, people can see just a black screen. Just try and stay on as much as possible. So from a treatment action campaign, Anele, you want more political will. You want to see the commitment being in action rather than just in words. Then, if that's the case, what do you think should be the priorities in fighting against TB?
The first priority, Praten, when we say do to TB what you are doing to COVID, many people who are living with TB are not diagnosed. And we are saying on point of entry in all public healthcare facilities, people must be screened for COVID-19. We are saying, Praten, also our government must speed up the process of registration of a fixed dose combination of 3HP as part of our TPT agenda to fight the tuberculosis. We are saying hire more community healthcare workers. We are saying inform, educate the public about preventative methods of tuberculosis so that those people who show signs of tuberculosis can be advised to present themselves within our public healthcare facilities in order for them to get treatment.
Okay, the pandemic has created a lot of problems. Lockdown, people were not able to access healthcare facilities. And we are told, I'm not a doctor, but Dr. Sifumba is here. You are healthcare people as well, Dr. Ndjeka as well, that some of the symptoms of COVID, like coughing, would be similar in a way to TB. So in the last 2 years, it's been very difficult to trace and help people with TB. Dr. Ndjeka, as part of the National TB Recovery Plan that you've mentioned, can we just begin there? What should be done to encourage people now, those missing 150,000 people, to be found? What should be done?
So we have a app, TB Health Check, which we really recommending for all South Africans. There'll be more around that on our website in the Department of Health. Our partners will also be talking about this because people need to really be screening themselves so that we know, so that they know whether they should be tested or getting treated if they found to have TB. But we also know from our TB prevalence survey that up to 45 or 55% didn't have symptoms. So we're prioritizing TB testing irrespective of symptoms for people living with HIV, household of that are contacts living with those with confirmed TB, and people previously treated for TB. These categories will be tested without any testing. But also we're bringing in digital chest X-ray. This is started already in the Global Fund supported districts. We're going to scale up in the rest of the country moving forward. So these are the efforts that we're going to be doing. More tests, urine lamp. We want to double from 2 million tests a year to 4 million tests, but targeting hotspots, not just going testing everywhere.
Yeah, no, there is a bit of stigma. Yeah, thanks, Doctor. There is a bit of stigma, Russell, around TB. When you're listening to what Dr. Ndjeka is saying, they want to ramp up and scale up the awareness campaign and the use of this app. What are you thinking?
Look, I think the app is an important indicator because, our approach in the report is really built on 4 different pillars, right? We support fully the priorities that are listed in the National TB Recovery Plan, right? But I think given that we've lost so many cases in this period, the immediate priority must be on targeted universal TB testing and treatment. And in order to do that, we already have the information systems. We need, from a supply side, we can also start understanding there are 14 districts that have been identified as hotspots. So the National Health Department and the partners have a good sense of where the biggest impact will be for targeted universal TB testing. Linked to that, we also need to look at our financing. So we have a very strong conditional grant framework that, if well coordinated from the national office, we can have the national TB program and the provinces working together towards a single goal. And I think when we reach that first mile of getting more people tested, we can initiate more people into care, we can increase our treatment success rates, and we can eventually start reducing TB deaths. So I think at the moment we have a lot of tools in our power. All we need is good coordination, good leadership, and aligning around a single goal. And for us right now, the main and the quickest priority is targeted universal TB testing, and we can build all the other systems around it. But our immediate priority is to get as many people into care as we possibly can, because, as you said, TB is curable, but to cure it, we need to test, we need to link positive cases with treatment, we need to complete treatment for those initiated into treatment, and we have to make sure that we invest strategically our human resources like community health workers. Community health workers are in our communities. They can look after that stigma. They can ensure that we can encourage people to test. Like you said, 25% of TB suspects don't show symptoms. So if you're not sick, you're not going to go to the health center to get a test. That's where community health workers, well trained and well deployed, can make a significant impact on getting us back on track.
Yeah, that suggests a lot of coordination, a lot of integration. But the targeted universal testing, Dr. Sifumba, when you hear that as a priority, I mean, even Dr. Ndjeka was mentioning that the government wants to ramp up the National Department of Health targeted testing, because then you'll be able to identify who's got it, who doesn't have it. Is that where the immediate efforts should go post the pandemic? Yes, we're still in the coronavirus pandemic, but in our country things are beginning to be slightly better. The numbers have been declining. Let's hope and pray that the fifth wave is not harsh on us.
Thank you for the question. So I do think that the increasing of testing will definitely benefit many, but as somebody who has survived TB and understands the difficulties of treatment, I think something that needs to be focused on from now and, for after the pandemic is maintaining the people that are on treatment. And when I say maintaining, I mean actually supporting people through the treatment. As someone who's been through the treatment, I can tell you that it is extremely difficult to take, not to say that it's not important to take, but I think a lot of people who haven't gone through it do not understand how physically it would feel and how painful it is. So I think I would like to encourage our leaders and encourage the people on the call. How do we actually retain people who are on treatment? Because there are many people that will start treatment, but unfortunately will stop because of the many difficulties that are faced. So I think for me, as an advocate, as somebody who's also worked on the front lines treating people with TB, one thing that I found that is very important, that is lacking, that we can definitely improve on, is supporting people actually so that they're managing to complete the treatment course. So I mean psychosocial support, psychological support and social support systems, so that people can actually fulfill, what they need to do. It's not that people are rebellious. The fact is the treatment is very hard to take. And it's very hard to complete the course. So I think from me, that would be, I think, something that I'd like for, to be, done going forward.
From what you've just said there, Dr. Sifumba, is that you would welcome, I've seen reports of people calling for shorter duration treatments for TB, because as you said, it's long and it's complicated, and to keep people on the TB treatment takes a lot of hard work. So shorter duration treatments, are they possible right now, Dr. Ndjeka?
Yes, shorter durations are possible. In fact, our local MDR TB expert have sent me communication. We had a meeting and they concluded that it is possible that we treat our MDR TB for 6 months. That's something that we want to do prior to the next World TB Day. So it's going to be one of the achievements that we will be, announcing for the next World TB Day. It is possible. It has a lot of advantages. One of them being the decrease in terms of loss to follow-up. But we also want to introduce the adherence package from HIV to TB. We want to strengthen that, because we realize that there are tools. We can't reinvent the wheel. We've not been using the HIV adherence tool. For TB, susceptible TB, there are plans to reduce the treatment from 6 months to 4 months, but it can be this year, maybe next year or the other year. We know that the World Health Organization is recommending that, but there's still a bit of work to be done locally before we announce about that. But there are serious plans. We are seriously considering reducing duration of treatment. Okay. And by the way, we became the first country in the world to give MDR TB all oral, and we continue. Other countries still give injections, painful injections that are toxic, and we continue in that way. Thank you.
See, Dr. Sifumba was applauding that last statement there. What about a vaccine? I mean, the coronavirus pandemic has created a lot of focus that South Africa has got scientists, we've got laboratories, and now we have a facility in Gqeberha that's producing coronavirus vaccines. Couldn't a vaccine be a solution? I just want to get your thoughts, Dr. Ndjeka, before I hear what the other panelists think. Anele, I'll come to you just now. Dr. Ndjeka, vaccine? TB vaccine?
The vaccine is critical. We need that. For many years, we believed that BCG, that we all got at birth or shortly after we were born, we think that it prevents against TB. It doesn't. It prevents against severe form of TB, like TB meningitis, which are very rare. But there's no vaccine today that prevents against TB in the lung, which we call pulmonary tuberculosis. There haven't been enough investment to get one, and I'm hoping that learning from COVID, we will have sufficient investment now and we'll soon get a TB vaccine. It is very important if we are to end tuberculosis. We need a TB vaccine that protects against pulmonary tuberculosis.
Yes, Anele, I'm sure Treatment Action Campaign would welcome a development where there was a vaccine, investment into that, because it would assist in terms of treatment and all sorts of complications that TB brings into our lives. Anele, can you hear me? I think we have a problem.
Yes, but then, yes, I can hear you. Can you hear me?
Yes, yes. What are your thoughts about a TB vaccine?
Yes.
We welcome any intervention that will ensure that the lives of the people are saved either from HIV, TB, or COVID-19. But also on the issue of the TB recovery plan, Praten, all what you are saying, we welcome it as it was announced, but we need clear timeframes. We need to know how much is budgeted for so that we can be able to go on the ground and monitor whether what is promised to the people of South Africa is implemented adequately. Thank you.
So you want more details around the National TB Recovery Plan. Well, if you're just joining us, it is World TB Day today. I've got with me Dr. Zolelwa Sifumba, occupational MD, TB survivor. She's an activist herself. I've got Anele Yawa, General Secretary, Treatment Action Campaign. We also have Russell Rensburg here in the studio. He's the director of the Rural Health Advocacy Project at Wits, and we're also joined virtually by Dr. Norbert Ndjeka, director of drug-resistant tuberculosis, the National Department of Health. He's on the line to us as well there from Kimberley. Very important discussion we're having. We will, of course, continue with it in the next while. Just stay with us. It is World TB Day. This is a forgotten killer. We cannot ignore it in South Africa. Just think about it. Nearly 1 million of our fellow South Africans have died as a result of TB since 2010. Join us shortly as we continue discussing this issue of TB and going forward, what needs to be done for us to eradicate it and take care of those who are suffering from it. We'll be back.